Hello, everyone. This is Q&A for digit sucking. Digit sucking is any of your digits, so thumb or finger. Um, my name is Mallory Miette. I am a speech pathologist. I focus on infant reflux and oral development. And so I'm going to give a couple seconds to let people join. As you have questions, feel free to ask. There were some questions submitted through Instagram, so I'm going to pull those up and start there while people are joining, listening in, getting their thoughts together. I first want to say that uh, thumb sucking or finger sucking is not, I don't like to say anything that a baby does is bad. It has negative consequences, and um, it's something that we want to look at. Whenever a baby is doing something that impacts something else, I want to know why they're doing it. Uh, I hope that as we talk through the questions, it sort of makes sense that there's a reason that they're doing it. Um, so let's jump into the questions. 12-week-old had started thumb sucking. How can I stop it from becoming a habit or a problem? So habits develop pretty easily, and that's one thing that is unfortunate about thumb and finger sucking is because it's always with them. And um, I want to first let's start by saying that thumb sucking or finger sucking, when I say thumb, I mean all digit sucking, is not the same thing as mouthing. I did get some pushback, not pushback, but questions about how toddlers tend to mouth everything. There's always something in their mouth, their shirt, crayons, toys, right? They're always mouthing something. And I think that that is where we should be starting. I think that every pre K and kindergarten teacher should have chewy tubes. Um, each kid has their own. How awful would that be to keep up with? I understand. Maybe we put them on a necklace for them. Um, but each kid has something that they can chew where we direct that behavior to something that is appropriate. And a lot of, I mean, people are going to be like, well, that just sounds disgusting having everybody have their own little chewy tube. They're going to be giving it to their friends. What do you think they do with their toys? What do you think that they do with their own hands? They putting it in each other's mouths. What do you think they do with all the other objects in the room? The difference would be that we can teach them this is yours, kind of like a pacifier. What do you think babies do with their pacifiers? I've seen babies take their pacifier out and put it in another baby's mouth. So, yeah, but we should be monitoring that like we do all other things, except teaching and giving them something that is positive input so that maybe we can get these babies the input they need into their jaw, and just maybe they're not just mouthing because they're toddlers. They're mouthing because they're seeking something. And if we can get rid of that seeking behavior by giving them, by fulfilling that need, then it will no longer exist. Um, and so we have to look at why infants, babies, 6 months, 8 months, 9 months, are putting things in their mouth because they're exploring. Once they learn how to use their hands and explore with their eyes and their vocabulary becomes stronger, the mouthing is not what they use for exploration. They then use the rest of their body. So I think that that's really something important to think about and consider is that toddlers are not the same as infants. While it may look normal because so many kids do it, remember our whole motto is just because it's common doesn't mean it's normal. And with babies who are given only soft foods when they're being introduced into table foods, or for those kids who have sensory issues, or for those kids who have maybe some texture aversions. Those babies are not getting the input that these muscles need. And I talked about it in my Instagram. I lost lots of followers for it. But if we are helping babies learn to move their bodies and gross motor skills, and we're helping them in their fine motor skills, why are we not also addressing their need for these muscles? These are growing too, and they're strong muscles. The tongue is a strong muscle. This masseter muscle for the jaw is a strong muscle, and it is housing so much in terms of function and growth, that we need to be giving it the input that it needs. And I'm a firm believer that your body intuitively knows what it needs. And so when we see a toddler putting everything in his mouth, they are seeking some hard work. And a pencil eraser is just not going to cut it. So we have a 12-week-old who started thumb sucking. Where can you go from here? A 12-week-old, so 4-ish months, right? In between 3 and 4 months, there's this huge growth spurt for most babies. In between that range, there's a growth spurt that occurs. Commonly goes along with the 4-month sleep regression. Everyone's so familiar with the 4-month sleep regression. But really, we need to be looking at, well, they just had a big growth spurt. Their body changed. Of course, their sleep is going to be impacted, and support them through that regression. But it's really not just sleep that they just magically started having an issue with. It is their body changing. And so with growth spurts come huge change within the muscular system. So the bone grows, and then that muscle, so your muscles surround your bone, and your bone grows, but your muscle has not had time to adjust to that growth. Okay. So their bone is literally pushing against this tight muscle. And until that muscle grows, then we can get them back into regulation. And so now we have this tightness, and that tightness can disrupt so many things, including sleep, including feeding, including what's going on with their need for input in the mouth. Um, so at 12 weeks old, I want to know, um, has anything changed with the feeding? Is feeding still going smoothly? If everything is going smoothly and we just started sucking the thumb, they are seeking something. If they weren't using the thumb before to put themselves to sleep or to calm down, it's my belief that they're not magically needing it, or they magically found out that they could calm that way, because infants will learn what to suck on to calm. So if they weren't, what were they using to calm before is the question. And then if we did have that growth spurt, what are we doing for their mouth? Can we give them some input? So if my 12-week-old is starting to suck their thumb, I'm paying attention to when they're doing it, because if it's to fall asleep, are they needing some other support to fall asleep? Do we need to rock them? Do we need to change our routine a little bit? Is it during the day, when they're awake, like during their wake windows? Because then we need to be giving chewy tubes. We need to be giving toys and have them bang. We need to give them some sort of input with their hands and input with their mouth. Sometimes you can do all the things, and because habits are so easily formed, they then discovered it. It does feel comforting and nice for them. And it's something that you're just going to have to keep redirecting. Um, and as long as we redirect, as long as we support them in sleep, we pull it out once they're asleep. If they use it to go to sleep, we lift that tongue up. We do all that support. Our hope is that then that habit that they have can break easier. Then, if we let it be, that habit can become stronger and stronger and stronger. At what age is finger sucking a concern? It's always a concern. And it's because it really changes the way the mouth is. So you have your finger or your thumb, and it's constantly putting pressure on the palate. The tongue is pushing this up against the palate space. Look how narrow that is. And that's the thumb. Imagine if it was a finger. Look how narrow that is. What if it's their pinky? Okay. Look how narrow that is, and that is being pushed up and up and up and up. And what is the floor of the mouth of the roof of the mouth is the floor of the nose. And so we're constantly putting pressure up here, and it's literally changing the way our nasal passages are. And then what does that do? Impact breathing. And if we can't get enough breath in, what are we going to do? Open our mouth. And then what does open mouth posture do? It leads to heightened a sympathetic response, which is opposite of the parasympathetic response in the body, which is rest and digest. Sympathetic response is fight or flight. And so we're constantly in this need for calming. So we go to our finger or thumb, which is what's causing the whole cycle. Okay. It's just like a pacifier. So if you're talking to someone and they say, should a 4-year-old have a pacifier? And they say, absolutely not. Well, then a 4-year-old shouldn't have a finger or a thumb either. The damage is the same. You're getting that overbite over the teeth, open bite sometimes, where the thumb sits there. You're getting that heightened palate shape. So if someone says that a pacifier is not appropriate, well, neither is thumb or finger sucking. It's doing the same thing structurally to the mouth. It's causing the same impact physiologically to the systems. Okay. So when is it a concern though? Because sucking to calm is appropriate up until a certain age. The problem is that you can't ever get rid of it. It's not a pacifier. You can't put it in a doll or fly it to heaven. It's always with them. And so while it is appropriate, um, I will always recommend trying to establish a pacifier use because you can remove that. It's that simple. Um, if your baby is reaching for their thumb or their finger, they are trying to suck to calm. And as an infant, before 3 months of age, they do that. Sucking is calming for them. It's a pain reliever for them. That is appropriate. And I will never say take that away from them. So, finger sucking and thumb sucking technically is appropriate at that age. And I would never say take their hand out of their mouth because they're using it to calm themselves, right? They can do that. The question then becomes what happens at 6 months, 8 months, 15 months? Is that we can decrease the use of pacifier, only leave it in the bed. You can pull it out and remove it from the crib when they are sleeping. We can be talking to them, give them other things to do during the day, which we can do with the finger and thumb, but you cannot remove it. You can't leave their finger or their thumb in the crib. You can't take it away eventually when you feel like baby is ready. And they may be ready one day actually to stop doing it. And you guys talk about it and it's strong, you guys feel good, and you're like, okay, let's do it. But what happens when they're having a bad day and they immediately go for what used to make them feel good? That's a habit, right? So if your baby's below 3 months, I'm always going to encourage to find some pacifier that they will accept and try to transition to a pacifier for the simple reason that you can get rid of it. Um, does it make a high palate worse? Absolutely. And babies with high palates may be, there's no research on this because who's going to research it, may be more inclined to finger or thumb suck because they can push it into that high narrow space. Whereas a pacifier, it sort of forms to it. I've seen babies like turn their thumb and fit it into their palate space, right? So they can use a finger or a thumb, however they can manipulate it to really get into that high palate that they already have. And then what is it doing? It's continuously pushing it up into into as high as it can go. And it's supporting that high palate. It's not bringing that palate down. At what age is digit sucking an issue? So we talked about that a little bit. 7.5 months sucks fingers to sleep and sometimes when awake. So again, now we're in that age where um we should be moving more into tongue to the palate to really set up that parasympathetic rest and digest. We should be moving away from like this heightened need to suck. Um, so at 7.5 months, what are you going to do for sleep? Nothing. You can't do anything because at 7.5 months, I'm surely not going to tell you to start taping their fingers. Like, right? Because that's a behavioral intervention, right? Tape the fingers, put gloves on, put a sock on and safety pin it. Those are behavioral interventions that people use to stop thumb or finger sucking. Get a guard so that they can't do it. But I wouldn't say do that to a 7.5 month old. They don't understand, they're not aware of what's going on or happening. So those behavioral interventions become more appropriate for around age 3. When you guys are talking about it, and you feel like they can at least understand the importance of not doing it for breathing, for their brain, and so forth. So at 7.5 months, I wouldn't do anything for sleep, except once they fall asleep, if their hand's like in their mouth, right? I'm going to pull it out and I'm going to try to close their mouth, get those lips sealed. Maybe start some taping because that is what can change. The when awake is where you can really make some difference. And when they're awake is why are they needing it when they're awake? When they're using it to calm to sleep, they're initiating that parasympathetic nervous system. We can support that. We can do that. When they're awake, why? Is it because it's just a habit so they're bored? And that is when we need to give them something to do with their hands, give them something hard to do with their mouth. So, a teether that they're just resting in their mouth and maybe it vibrates and it's not doing much in movement. I want movement. So I want them to be chewing on chewy tube. I have lots of Instagram posts on that. Okay. So it's more about what you can do to support them when they're awake. And then once they're asleep and the finger or thumb's just hanging the mouth open, then let's support that. My 8-week-old baby has significant oral ties and has started sucking on his hand. This is bad. Now, sucking on their hand is different. They're not putting pressure on the palate. This is a seeking behavior. If they're struggling with, well, they have oral ties. I would say if they're having oral ties and they're sucking on their hand, they're probably suffering from some degree of reflux. It may be silent reflux where it's not coming out of the mouth. But if they're actively sucking and they have oral ties, I would imagine that there's some impact on their feeding. Um, they're getting some kind of air intake from it. They're having some discomfort, reflux happening because of that. So I would look at feeding first and figure out how we can improve feeding itself in order to decrease discomfort afterward. Because in my mind, I immediately think they're sucking in order to produce saliva to swallow. Because swallowing is pushing that discomfort down and it's making them feel better. So mouthing, sucking on his hands, like, I guess that is what I imagine when you say sucking on their hands is like their whole hand is in their mouth, right? Or they're sucking on the edges of it. They're trying to suck and swallow. So if you think feeding is beautiful and there's absolutely no issues with feeding and you know that there's no issues with feeding, and the oral ties are not impacting that, then what is going on? Mm, I just now I'm curious. So I guess follow up with me if you're listening to this later. Um, because that is when I read that, that is the scenario I imagine, and I would want to correct feeding to decrease any kind of discomfort or reflux that's occurring, and then you might see a decrease in that hand sucking. But at 8 weeks old, you can also give them things to do in their mouth, like a chewy tube. You can support them, you can help them hold it and chew on it. They can chew on your finger. Um, so it's why, right? That's my question. Why? And I don't like to think that hand sucking is part of their exploration because they're not exploring anything. Um, Mouthing toys is exploring. They're exploring different texture and taste and what this object can do by moving it around in their mouth, right? That is much different than hand sucking, in my opinion. Explanation of when it's normal or reflexive and when it's not, how early to intervene. So, normal and reflexive when they're using it to stimulate their parasympathetic nervous system in order to get themselves and rest and digest. That is how they're utilizing that method in order to stimulate that need. I would never recommend a behavioral intervention without giving an alternative in order for them to reach that, because then they're constantly in fight or flight, and we do not want that for them. So, in terms of normal and reflexive, that they are trying to get themselves into a state of rest and digest, and that would be considered normal. Okay. How early to intervene? That kind of goes into the other question that I would try if you have a finger or thumb sucker from birth. I'm trying to integrate a pacifier so that they can utilize that, because behaviorally, when the finger and thumb sucking becomes a habit and not out of need or reflexive, a pacifier is much easier to get rid of. So that's the main thing that we need to be focusing on, is that oral seeking is much different than putting a baby into rest and digest. And that a pacifier behaviorally later is much easier to get rid of than the thumb or the finger. Now, sometimes it is what it is, and you can try your hardest, and your baby is just going to be a finger or thumb sucker. And usually, I find that it's because they have a high palate and they like the input that they can get from their finger versus a pacifier. Plus, it's more tactile too. Like, they're feeling it. So they're getting the input here, they're getting input in their mouth, right? It's more personal. So I know people who have tried to get their baby on the pacifier to no avail, and they just have a thumb sucker. Well, then we have to look at what can we do to lessen the impact of it while they're, I would say 8 months to, well, 6 months to 18 months. You keep their hands busy when they're doing it out of boredom. When they're using it for sleep, you're going to pull it out, you're going to try to get the mouth closed. Okay? Because yes, the thumb or finger makes negative impact to the palate, but the tongue can make positive impact to the palate. So if we just have this for the 15 minutes it takes for them to fall asleep, and then we remove it, we get the tongue up during the day where the tongue is moving and it's strong and our jaw is strong, then you're gonna have much less of a negative impact, if that makes sense. But then you're still, the behavior is still there, right? And as they get older, so at that 18-month mark, they start to really pull into their attachments. And I find that the 18 to 24-month-old range, um, it's almost, we have to take a step back from intervening with it, because the more we talk about it, the more they want to do it because of that attachment to it. So you can redirect, like, oh, here's a chewy tube, but we're never addressing, get your finger out your mouth, get your thumb out your mouth. We don't do that. Big girls don't do that, right? And constantly pulling it out. That pull from their attachment may increase that need. And then when they get into like the 2.5, 3, we can start talking to them about, we need our mouth closed to breathe, and how it makes our brain strong, and how it can make us run really fast if we can breathe through our nose. And if we have our thumb or our finger in that, can we breathe through our nose? And they start to put things together, and they can really start to talk to you about it and be proud. Look, mommy, I got my lips closed, right? right? And then you acknowledge that, and there is a you guys are working on it together versus a constant, "No, don't do that. Take that out." Big girls don't do that. Big boys don't do that, right? So in that in and how much easier is it to say, "Okay, we leave the pacifier in the crib," and then all day there is no pacifier use. And now you're getting other input from other things, and the relationship starts to fade. Their need starts to fade. Can't do that with the thumb or finger because it's always there. So they get upset in a moment during the day. They immediately go for that, right? And while they're upset, we have to take a step back and realize that they are trying to put themselves in a calmer state, and you can't take that away unless you're offering something else. So maybe you start humming with them. Oh, remember, we don't want to hurt our palate. We don't want to hurt our at the top of our mouth. We want to be able to breathe nice through our nose. And so, do you want to hum with me? I can see that you're upset. Do you want to hum with me? Or I can see that you need your thumb to help you calm down. Is that right? Let's try humming, and then you can rock. Mm, mm, mm. Okay. And you're giving them something, humming. People hum all the time. Okay. And then you're with them, you're there supporting them instead of the negative piece towards the thumb or finger sucking. I know that it's hard. And so I'm not going to sit here and say at 8 months old, if they haven't stopped finger or thumb sucking, because that is not going to happen, you need to wrap their hands up and force them not to do it. Um, how awful is that? You're I mean, they're needing it. Um, and as an adult, I mean, I have a bad habit, right? I pick my nails. Awful habit, not my nails, my cuticles. I don't even recognize I'm doing it sometimes. But I know that if someone said, "Okay, we're gonna wrap your hands up," one, I like that person a lot less, right? Two, I'm a grown woman and I can understand the importance of needing to stop. Totally get it. It's gross. It's an awful habit. So, cognitively, I can understand why they're doing it, but it still doesn't make me like them anymore. Now, imagine you're 3. Imagine you're 18 months, right? I would never recommend that. So while it can have negative impact on oral and facial development, there are ways to support better movement and activities throughout the day. Sorry, allergies. Better activity. There's ways to incorporate activities to improve function and lessen the impact that it will have. But always ask yourself why. If it's to put them into rest, then if they're old enough, 2.5, okay, some 2-year-olds, 2.5 if they're a boy, closer to 3, um, can you give them other ways? Let me pull one out. The little munchie dupes I have, if you guys don't wanna get a munchie, a Mayo munchie, I talk about these things all the time. But have them put that in their mouth and encourage their tongue to go where it's supposed to go. It gives them that nasal breathing practice, chewy tubes. And if they're here, encourage them to go here so that they're really chewing and getting that input. So always ask why. Can you give them something else to calm, like a cuddle and a squeeze and a hum? Once they're calm, how can we redirect them to do something meaningful to get the mouth moving in a better way? Okay. So similar to the pacifier, except it's harder. I hope that helps. Know that it's not anything bad or wrong. It's how can we support them to the best of our ability because it does have a negative impact. But we can lessen that impact and we can really support them in their need if we can take a step back and ask ourselves why. Okay. I hope that helped break down a little bit more. Um, and you know where to find me if you have any other questions.